My name is Dr. Maitreyi Raman, and I'm a gastroenterologist and physician nutrition specialist at the University of Calgary. Today, I'm going to talk to you about dietary updates and recommendations for the IBD patient receiving biologics. When you ask patients, 48% of patients felt that diet could initiate their IBD. 57% of patients felt that diet could trigger a flare of their IBD. 60% of patients reported worsening symptoms, particularly with certain foods. 2/3 of patients deprived themselves of their favorite food to prevent relapse. And 50% of patients did not receive any formal dietary advice at all. And these data came from a large prospective questionnaire from 400 consecutive IBD patients in the United Kingdom. Now, turning away from patient thoughts and looking at the global epidemiology of IBD, we see that between the years of 1859 and 1956, IBD particularly affected individuals living in industrialized countries, largely in the Western world. But in 1956, the first case of ulcerative colitis was reported in China. And ever since then, the burden of IBD has rapidly grown in countries that are newly industrialized. Dietary patterns and environmental influences also have changed globally and very rapidly over these years, again indicating potentially to the role of the environment and particularly that of diet in new onset cases of IBD. Now, looking at this from a study perspective, there have been a few very large prospective studies that have also highlighted relationships between diet and new onset IBD. In the first study published in Gastroenterology, a high impact journal back in 2013, over 170,000 female individuals were followed up over 26 years. In that study, dietary fiber was found to be strongly protective against development of new cases of Crohn's disease in particular. But interestingly, all sources of fiber were not considered equivalent. Fiber coming from fruit and from vegetables was found to be more protective against developing new cases of Crohn's disease. Interestingly, no dietary fiber signal for protection was identified in ulcerative colitis. Now, looking at other dietary components from that very large study, legumes and nuts, intake of these at the highest level compared to the lowest level was also found to be protective against Crohn's disease. Similarly, use of olive oil was found to be protective against new diagnoses of Crohn's disease. Now, from another part of the world, another large prospective cohort study that included over 80,000 individuals were followed over 20 years. In this study, they sought to identify whether a diet pattern that was more consistent with a Mediterranean diet compared to less consistent with a Mediterranean diet had any effect on developing new cases of IBD. They found that over these 20 years, those individuals that had a diet most consistent with a Mediterranean diet compared to one that was least consistent with a Mediterranean diet had the lowest risk of developing new cases of Crohn's disease. Interestingly, the same signal was not identified for ulcerative colitis. Now, very recently, there was quite a large observational cohort study that was conducted between 2003 and 2016 in over 21 countries around the world. This was truly a global study. And in this study, over 136 individuals participated by providing their dietary data for analysis. The goals of this study were to identify whether processed foods and or food additives might have a role in developing new onset IBD. During this period of time, 467 patients were found to have new onset inflammatory bowel disease. And the study investigators identified that consuming greater than or equal to 5 servings per day of processed food was associated with an 80% increased risk of developing IBD compared to no processed food intake at all. Now, specifically, intake of greater than or equal to 3 servings per day of soft drinks was associated with almost double the risk of new IBD development. Intake of added sugar and sweets greater than 100 grams per day was associated with 2.5 times the risk of developing new IBD. And intake of salty foods or snacks was associated with double the risk of developing new IBD. So these large studies that I've discussed with you that have been conducted over long periods of time suggest that diet is an important risk factor for developing new inflammatory bowel disease.